Good morning. This is Dave Whorton. Welcome to the Evergreen Experience 2020 on this Friday, June 5th, 2020. The goal of this conversation is to provide real-time insights into Evergreen leaders' experiences and innovations in this period of crisis, uncertainty, and rapid change. Today, I'm joined by Jim Kimzey, CEO of Rose Dementia Care Specialists, and Samson Liu, CEO of Sohdental. Both Jim and Samson lead businesses in the healthcare industry and are designated as essential services. Both are navigating significant challenge and in some cases, surprising opportunities. Jim and Samson will each speak to their experiences, including their shared focus on client and staff safety, and the steps they have taken to strengthen their teams and their processes. With that, let's get started. Welcome, Samson. Welcome, Jim.
Good morning.
Thanks for joining me. I appreciate it.
Sure.
So, Samson, can I start with you? Can you tell us a little bit about yourself and your business?
So I'm a dentist by training, and I work for a DSO or a dental support organization for over 20 years. What that means is we are a group of practices that we share the back end. So we manage and own the practices, and we improve the efficiency, and we use our scale to leverage our cost savings. So I was with a private equity-backed company for about 20 years until all the reasons why I left, because it's private equity owned. And so I left and started my own company 2 years ago in 2018. And it's called Sohdental. And so my company is very young. It's only 2 years. But I was looking for something different, looking for an evergreen mindset in my company. And that's how me and Dave got started. But my motto is the same. My company is that we primarily do acquisitions of dental practices. We partner with the doctors on different levels, and then we help them improve the efficiency and productivity, and we consolidate on the back end. So
that's great. Thank you, Samson. Jim, same question for you.
About 15 years ago, my mother was diagnosed with Alzheimer's disease, and my family and I, had to figure out what to do for her. And it was kind of during that process I got this inspiration to start Rose Dementia Care Specialists. So I started the company 11 years ago. We're based in San Francisco. And what we do is we take care of people who have Alzheimer's disease and other forms of dementia in their homes. And some are actually in facilities, and we provide extra one-on-one care there. And so we're based in San Francisco. We cover 9 counties. We have about 130 employees, and we do about $10.5 million a year in revenue.
That's great. Well, I'm going to stick with you, Jim, but talk a little bit about what was the state of your business kind of heading into the COVID shutdown, and then kind of what happened to you, that external shock. What was the impact on your business, and how quickly and how severe?
So our business has been growing year over year, really well. And I'd say, in February, we were having like the best month we've ever had. Revenue was growing. We were really focused on growth for the future and the things that we were going to do. Like we had just had like our strategic planning session to talk about like how we're going to like blow it out in 2020. And of course, things changed pretty quickly. When we realized that we were going to have a big shock to our industry, we didn't know how bad it was going to be. And I was preparing for like a 30% drop in revenue. And it turns out that our industry hasn't been hit nearly as hard as other industries. We ended up losing 10% of our revenue over a 3-week period that started with when San Francisco, had the stay-at-home order. We've since been able to build that back up. Some of that's taken advantage of some opportunities we've identified that we'll talk about later. But at this point, we're basically at the highest revenue we've ever been, and we're kind of looking at continuing the plan that we had before all this happened to go ahead and just keep growing, but we're doing it in a little bit different way now.
Well, that's great, Jim. So we will come back to that in just a moment. Samson, similarly, how was the business heading into this year? How are you looking at the future before this kind of COVID shutdown? And then for you, again, what happened? How quickly was that external shock? And then how severe?
So as I mentioned before, we started in 2018, and we were in a very strong growth mode. So we ended 2019 with $38 million in revenue and about 350 employees. So on the first 3 months of this year, we were ramping at 15% above our budget. So we were really, basically we're hitting on all cylinders. We're going strong. We're above goal. And then in about first week of March, there was beginning of announcements or reaction to the pandemic. And so in over a course of 14 days, we went from 115% to 15%. So effectively, we have about 30 locations, and all 30 locations systematically shut down every other day, so to speak, staggered. One day where one office shut down, the next day another office, and it just went from 100% revenue to zero in some offices in a matter of days. So by the end of March, we only have offices that are open. And when they're open, I meant they're only open for emergency patients only. So that means from seeing 30 patients a day to seeing 1 patient a day. So, but that's considered open. And, but about 1/3 of the offices are completely shut down by the end of March. And so all that happened in 14 days. And so we basically ended the month with the first 2 weeks in full cylinders, and the last 2 weeks was practically zero revenue. So the entire month become from 115% to 75% of budget.
That's incredible. And that's even though you were deemed an essential service, correct?
So there was a lot of conflicting guidance that came out. So it was from empowerment to abandonment is kind of the way I put it. So when the initial pandemic came out, there was a lot of support from industry associations, from the American Dental Association saying that, hey, you know what? You guys are the professionals. You use your best judgment. You take care of your patients. In a matter of days, in a matter of hours, not days, that narrative just changed overnight to the Texas Dental Association is a good example. We have 16 dental offices in that state, and the Texas Dental Association says one week ago, they say, you know what? I trust you guys. You guys are great dentist professionals. You know how to protect yourselves. You know how to take care of your patients too. 1 week later, we have a hotline. If you know anybody that's open, make sure you report them. Because we're gonna shut them down because we think you guys are high risk for spreading the coronavirus. So it's just a narrative change overnight, and it was really confusing. Where we have hours before we know whether we can open the next day or not, literally, because there was a lack theory. The president say we're essential services, so then we say we can open. The next day, the American Dental Association tells us that you cannot open. Then the next day, the Texas Association saying that, no, you can open. And then the third day, the county said you cannot open. So every day, we don't know, can we open the next day or not? Because literally, there was such a lack theory between the different level of the state government. We don't know if they talk to each other or not, but they just make their own decisions. And we have one office, one street from each other, 2 offices in Texas, in Dallas. One street is on one county on the other side, and the other one's on the other. One county said they are closed the next day, the other one said you can open. So one open and one closed, and they're about, 100 meters apart. And it's unbelievable.
That is unbelievable. And remind me too, was it the dental hygienists were considered the #1 most at risk job with the pandemic?
So there was actually a Wall Street Journal article, I think it was 2 days ago, regarding the dental profession. So the dental hygienist is the #1 considered the highest risk of contracting or spreading the coronavirus because of the aerosol they produce with the ultrasonic instrument they use to clean teeth. And the dentists or dental assistants are not far behind. They're all like top 5 most at-risk profession. Now, but that's speculation because as far as the ADA is concerned, they just released an announcement just within the last 2 weeks saying that the president of ADA says that there's not been a single case that have been reported that a dental office has been involved in the spreading of the virus or the contraction of it. So it's actually the opposite. It's one of the safest places from getting it. You walk into an urgent care, you're probably more likely to get it than going to a dental office. But that's my personal opinion.
That's amazing. So Samson, I want to come back to you in just a moment. Yeah. Jim. Now,
repeat the question. Okay.
Well, I was going to say, I'm a little confused because you're sending caregivers into people's homes, correct? to
Right.
take care of these patients in their home facilities. It kind of sounds like that's not the recipe for record revenues. Giving people, I'm sure, very nervous about having the virus brought into the homes of the parents and the people they know and they care about. So could you talk about how you adapted to this? How you've innovated
Sure.
so that.
I think it's important to understand that, like in home care, there's just a wide variety of different patients with different needs. And the industry, that like some home care agencies provide sitters in hospitals and like kind of companion care and assisted living facilities, and maybe what I would call discretionary care in the home, like nice to have, 4 hours a day, 3 days a week. Almost all that business went away overnight for the industry. Like the hospitals just shut down. Nobody's coming in. Most of the assisted living facilities shut down unless you were essential for an individual resident. But for us, so our industry wasn't impacted as bad as most industries, and our business in particular was not impacted as bad as most home care businesses, mainly because of our focus. I mean, all of our clients have dementia. All of our clients need a lot of care over a long period of time, and so we lost a little business, but most of our clients can't afford not to have us taking care of their loved one because they just don't have the skills and experience or even the bandwidth. I mean, somebody who's in the late stages of Alzheimer's disease needs one-on-one care 24/7, or they need some care 24/7, right? So if they're in the home, it either has to be a family member or a caregiver there all the time. And so it turns out, though, like the opportunity for us is, I'll talk a little bit about the challenge and the opportunity. The thing that has worried me the most since probably mid-March is one of the features of this virus is that something like 25 to 50% of the people who are infected are either asymptomatic or pre-symptomatic. And so what that means, and so think about this, like all of our clients are elderly. They all have multiple health conditions, including dementia. So they happen to be the most at-risk group. Most of them are in their 80s or 90s. And so if they get the virus, there's a really good chance that they're going to die from it. Like something like 15% of people over 85 end up passing away if they get infected. And so what kind of hit us early on was our clients are safe in their homes, they're sheltering in place, and their biggest risk is our caregiver bringing that virus through the front door and infecting them. And so that was like, we kind of quickly realized like our biggest risk to our clients is us. And so how are we going to deal with that, right? And so, early on, there weren't a lot of protocols, and the CDC protocols that were put out just weren't adequate. They weren't really accounting for the fact that so many infected people were asymptomatic. And so we essentially had to develop protocols that assumed that all of our caregivers are infected. Like, assume the caregiver's infected, now how are we going to protect our patients or our clients, right? And so, I mean, what that meant was we had to have very strict protocols around hand washing, around wearing masks, around social distancing in the house with the client. Like, don't get within 6 feet of them unless you need to provide personal care, like helping dress them or help them with incontinence or, help feed them, that kind of stuff. So we're maintaining our distance in the house. We're wearing masks. We're washing our hands frequently, but we're also disinfecting the house multiple times a day because we're assuming that we're infected and we're leaving germs all over the place. And so we did that. And, one of the big things in our industry is just like, can you get the personal protection equipment, the PPE, the mask and things like that. And that's been really, really hard. We've had probably a team of like 7 people working many hours every week. And I mean, finally, I think I solved the problem last week. For about the next 3 or 4 months, I just bought as many masks as I get my hands on and paid a really big price for it. But the opportunity then became is like, okay, you have a lot of people who need care. Where are they going to get that care, right? Because they can't, like if they put their loved one in a facility, that's where most of the outbreaks are happening. Something like 30 to 40% of all COVID-19 deaths have happened in skilled nursing facilities, long-term care, or assisted living. And so what happens is when there's an outbreak in one of those facilities, it can spread pretty quickly, and it's hard to prevent because the only thing that they were doing for a long time was just screening workers as they were coming through the front door, like taking their temperature, asking them questions, but that's not going to catch the asymptomatic or pre-symptomatic carriers of the disease. And so it's not unusual to have facilities where there's an outbreak and 10, 15, 20 people die within that facility, and some workers as well. And then the other aspect of that is if you have your loved one in a facility, in just about any part of the country right now, you cannot go visit them, like whether it's a hospital, whether it's assisted living, whether it's skilled nursing. And so, you know, family members now have a huge disincentive to put their loved one in a facility, but they still need care. So that actually creates demand for home care. But then we also have people who are in their homes that maybe, you know, we usually lose clients one of two ways. They either pass away or they move into a facility. Well, none of them are moving into a facility anymore. You know, they're willing to pay. It's actually more expensive to care for them at home, but they're willing to pay that because they don't want to lose all contact with their loved one for, you know, potentially like the last 6 months of their life, that kind of thing. So we've really positioned ourselves as the safest alternative. Like if you need care, we can do it more safely than anyone. And so we've got more strict protocols than most home care agencies. We're certainly safer than any facility.
And if I missed this, you do also have less shift changes too. You made a modification.
Oh yes, yeah. So one of the operational changes we made is it's pretty common in home care for caregivers to have multiple clients. Like they're going from client to client on different days. Sometimes within the same day, they might visit 2 or 3 clients. Some clients have multiple caregivers into the home. So one of the things that we did very early on is we said, we're going to look at every single client schedule and every single caregiver schedule, and we're going to create the safest schedule possible. And so we created kind of the theoretical optimum schedule for every client, and then just said, how are we going to get to that? And so the idea being, let's limit the number of caregivers that are on a client's team, and let's limit the number of shift changes that are happening with the client, and that'll lower that client's risk, because every time a caregiver walks through the front door, they have a chance to bring the virus in. But then on the caregiver side, we also said, let's limit the number of clients they can work with. And then, like, one of the big things we did is we said, if you're working with a client in a facility, you can't work anywhere else. Like, that's your only client, because we don't want any of these caregivers to be a vector of transmission of the disease. And so, I mean, so far we've had no clients diagnosed positive and no caregivers. So we don't expect that to last, but we're feeling pretty good about this. But one of the things that turned into a pretty big opportunity for us is we looked at it and we said, okay, if we kind of go to the extremes, like how can we limit the number of caregivers and the number of shift changes? One of the best ways to do that is to provide what's called live-in care. And so live-in care is where the caregivers are actually sleeping for multiple nights in a row in the client's house, and they're providing 24/7 care. That used to be a common thing that happened in California. The labor laws changed and made it prohibitively expensive because, I mean, we used to not have to pay for sleep time or overtime, but now we actually have to pay. If a caregiver's in the house, like if they're working more than 40 hours a week, we have to pay them overtime. And if they're sleeping, we still have to pay them even at overtime rates. So it makes it pretty expensive. But what we did is we basically created a live-in program. And so to give you an example, with one client, they had 2 different home care agencies working with the client. One was doing the night shifts because they were less expensive and they're trying to save money. But they had 2 home care agencies, 6 caregivers, and 16 shift changes during the week. And we were able to take all that business away from the other home care agency, but do live-in with 2 different caregivers, each, you know, one working 3 days, the other one working 4 days. So we went from 2 agencies to 1, 6 caregivers to 2, and 16 shift changes a week to 2 shift changes a week. That client absolutely loves it. And we're actually saving them a little bit of money over what they were doing previously. And operationally, it's a lot less complex. And so the other thing that we're finding is the opportunity for us is, you know, a lot of times people, they're on the fence about, do I need home care or not? Do I need home care or not? And the families are making trade-offs between things like, how much does it cost? How much independence does my parents have? How safe are they? And now, like, kind of the golden phrase is, you want to keep your mom out of the hospital, or you want to keep your dad out of the hospital, because a lot of times what happens is people put off getting home care, and then they have a fall, or then they get sick, and then they have to go into the emergency room. Most families now will do anything to keep their mom or dad out of the hospital. And so that's actually giving us a way to get people off the fence to start care. And we're also just seeing that we're getting more medically complex cases. You know, we're not a medical company. We don't provide medical care, but we're we're getting cases that ought to be in like a skilled nursing facility, or maybe they should be going to the emergency room, but the families are so afraid of the virus that they're bringing us in. They're essentially creating a skilled nursing facility in their home. They're bringing us in to provide the day-to-day care, and then they'll have like a house call doctor come in and visit, and a home health nurse come in, and that kind of thing.
Great. Thank you, Jim. So Samson, where I left you, 115% growth plan down to 15%, conflicting guidance from county, state, every people 100 meters apart in 2 different counties. So how have you adapted to this? What measures did you have to take, and how have you adapted?
Well, it's I would say that, you know, the number one challenge in the beginning was personal. I had to go through my personal stages of change. I was going through denial. I was angry. I was trying to figure out, is this really happening? But once I got over that, you know, we kind of come up with a business strategy. Is we're going to use this time, you know, so to speak, close for renovation. So what we're saying is that we're not shut down, we're just closed for renovation. So what does that mean? That means that we're going to focus on building up our team, building up our culture, and then we're gonna make sure that we're patient first, because I wanted to make sure it's a positive message throughout this whole crisis. And so what does that mean is, by the end of March, by the end of March, we have furloughed 250 employees. So out of 300, we've basically 75% furlough. The thing is, with the dental field, people are already very scared. So there was a whole lot of voluntary furlough. There wasn't really any, so that's one way to contain the cost right away. Our doctors are all commission-based. So when they don't work, they don't actually get paid in a sense. But however, most of the doctors are already compensated based on what they were doing in March. So we knew that we're going into an April where all the expenses are now coming due, but then we have no new revenue coming in. So that we knew that was going to be a big cash crunch coming up. I mean, we applied for the PPP loan like a lot of people did. But we were able to, but I wanted people to not focus on reducing people's pay. So we did not reduce anybody's pay. We just furloughed people because offices were shut down. There was just no way to bring them back. And then we also were focusing on, instead of reducing costs, I wanted to reducing cost infrastructure going forward. I want to make sure that if you're going to separate team members and furloughing them, it's on you if you're going to bring people back later that are only your A and B team players, and don't bring any C team players back. And so I want people that are here to build a culture and not here to disrupt the culture. And so we have a lot of long-term team members that came with the practices when we bought them. And I say, you know, I hate to say it, but this might be your opportunity to improve the people and the culture in that office. And the biggest thing we did was we want to communicate to everybody about the new normal. We want people to understand that, you know, going into this and coming out of it, it's not going to be things the way things used to be. You know, so this is an opportunity to calibrate mindsets from everybody, from doctors to assistants, on what it's going to look like going forward. You know, why is it important for us to consolidate some back offices? Why is it important for us to use the best quality labs and supply vendors versus what you were using before? Why do we don't have somebody to clean your fish tank once a week versus, you know, things like that. So we were focusing on those things, and we also took a lot of risk. So we looked at the opportunities across our landscape. In the industry, when this happened, it pretty much put the whole M&A activities to a halt. And so basically everybody that was buying offices, everybody that was selling offices were completely stopped. I actually had a few in the pipeline, with a whole lot in the pipeline. We're actively, you know, vetting them, and everybody wants to stop. But then I looked at the opportunities, like I want to diversify and take some risks. While a lot of people are conserving their cash and conserving their credit, knowing not how long this is going to be, I was looking at what I need to do now in order to be successful for the rebound. So I actually took risks. Instead of conserving cash, I went and invested in 2 more dental practices when nobody was actually doing it. The broker called me like 50 times. Are you sure you're going to go through with this? Are you really sure you're going to go through with this? And I say, yes, I'm going to do it. The reason for that is I realized that despite the spread of the coronavirus, the opportunity is there's a geographical stagger that goes on. So in other words, my offices were an example. One office was shut down 1 week and another office was shut down another week. So, and the virus is spreading from one side of the continental United States to another. So I actually bought 2 practices, one on the East Coast and one is as far west as possible, because I want to also stagger the recovery time of the dental practices. And and because they were shut down at different rates and they were restarting at different rates, I knew that I needed more cash to backfill into it as we recovered. So I actually went and bought 2 more practices because of that. And in the period when nobody was doing any business, I was and everybody said I was crazy. But I also want to make sure that people understand that I'm not looking at what we're doing now. I'm looking at what we need to do to build for the long-term sustainability of this practice. And so I actually role model myself from a culture and a team perspective as well. Like if I'm asking you to really evaluate your best team players and retain the best talent and laid off the worst talent and upgrade and improve the culture, I'm going to do the same. So I actually took this time and I actually upgraded my CFO and my controller during this time. People say you're crazy during this virus. Why would you let go of your CFO and your controller and replace them? So I actually did, because I thought, you know what? If I'm going to make other people improve the team and the culture, I'm going to do the same. So I actually hired my new CFO, never met him in person. And people are like, are you crazy? You hire a CFO that you've never met in person. I said, no, we have done about 15 Zoom calls from beginning to end, from first interview to interview with the team, to weekly conversations, to the first hire date. Never met him in person once. He's never seen the office. He's never stepped foot. He started the first day and it was on Zoom, the whole thing. And he's the best, he's one of the best hires I ever made. So to me, it's like, I took a lot of crazy risks in hindsight, but at the time, it just felt like it made sense. And so I have to say that we were lucky in the sense that the industry rebounded a little better than we thought. So instead of a swoosh Nike recovery, it seems like the dental industry is going through a V-shaped recovery. It kind of tracks a little bit to the economy, where we were 75% in March, we were 15 to 20% in April, and we're back up to 65% in May. And we're expecting to be 85% in June, maybe more. And so by July, we should be back to normal. But a lot of the costs that we incur as a company is all variable costs. It's all very service related. So when you shut down, a lot of the costs over time takes care of themselves, because you're not incurring any supplies costs, you're not incurring any salary costs until the offices are open. So right now we're going to that stage where we're actually busy, but then our cost is very low because the cycle is rolling over, where, April, we have hardly any expenses. So now we're actually in the opposite on coming out of the back end of it. So it's an interesting cycle. So.
Yeah, sounds like a lot of people are calling you crazy, Samson.
Yeah, a lot of people are. A lot of people calling me crazy.
But let me just, if I can recap that. So your revenues were down from 115% just to 15%. You had several very soft months, but in that time you retooled your team, you retooled your processes, you asked your dentist to think about who they want to prioritize bringing back. And it sounds like geographic diversification helped you quite a bit, because you could have some offices open at some times and others offices open at other times. Whereas if you've been just in one geography, let's say Dallas alone, you might have been in much worse shape. Is that fair?
Yeah. Yeah, so this one, the part where if you were a solo practice, you would be kind of stuck with that. But because of our diversified geographical footprint, we were able to mitigate that just from various aspects of it. Another thing is we were lucky in terms of, I know Jim mentioned about the PPE. And so one of my biggest model to my doctors is that I did not want to over communicate. A lot of companies tend to over communicate in times of crisis, but with everything about the virus 24/7, I did not want to do that. So when I was in April and March and May, my communication was not about the virus, but about patient first. So whenever there's issues with the communication, is not about what the virus, we're here for you. It's about, hey, you know what, focus on the patients, take care of your patients. A lot of the shutdown guidelines say that you can only see emergency patients only, but then they define emergency patients as life-threatening. So I don't know about you, day for Jim, but I don't think ever anybody walking in the dental office with a life-threatening emergency. If they do, you're going to tell them go to the emergency room. You wouldn't tell them to come on in, we're going to take care of it. So it was a very confusing time whether you can see a patient or not. So my communication to all the offices and the team is about patient first. And I use myself as an example because I'm still a practicing dentist. I see patients throughout the entire time, emergency patients only. And I gave them three examples. Like I had a patient came in that lost their jobs because of coronavirus. She has her braces on. She wanted to go in to see a dentist to take her braces off so she can go interview for a new job. Not a single doctor will see her. So I said, I will take you because I don't want to be abandoning a patient. So I took off her braces bracket so she could go interview for a job. And I have another military personnel coming in to get a medical clearance so he could get deployed. But no dentist saying that's not an emergency, go find somebody else. So I said, I'm going to take you because you know what? If you're going to be deployed as a military and you can't get somebody to clear you, I'm going to see you and I'm going to do an exam, I'm going to clear you. So those are the things, is it about patient first or is it about, emergencies only? So to me, there was a lot of conflicting guidance. They're basically asking us to abandon our patients. But the biggest thing is, as a group, I was as a member of YPO, I was able to secure supply chain for the PPE early on, right off the bat, and we were able to continue to supply all the dental practices with the PPE so they could continue to take care of the emergency patients in a safe environment. So we were lucky to be able to shoulder some of that, and so those are some of the things that we did to try to mitigate through it and trying to stay positive the whole time.
Yeah, good for you, Samson. That's incredible.
Yeah.
So we just have a minute or two left, but Jim, how are you feeling today versus maybe mid to early March? And looking in your crystal ball, what's your view on kind of your industry and its recovery?
Yeah, I'm very bullish on our industry. I think we're entering, like maybe the next 10 years, probably the golden age of home care. A lot of things that used to be very hard for us, like in the Bay Area with 2 or 3% unemployment, if you want to hire somebody, that's not a caregiver, the competition was, really hard. The salaries were really high. People moved around a lot. The caregiver, in our industry, turnover of caregivers was like at 82%. I mean, it was kind of reaching like fast food levels. And so it's hard to invest in training and, getting good caregivers and stuff. And what we've seen almost overnight is all the hiring problems have gone away. The quality and the quantity of the caregiver applicants has gone way up. All the caregivers that we're hiring and training now are on average a lot better than what we were getting a couple of months ago. And one of the things we've talked a lot about in different tugboat events is this idea of like no man's land, getting stuck there where you're like too big to be small and too small to be big. And so we're actually looking at this as an opportunity. We got PPP funding, and it's a significant amount, and it's going to all be forgiven. And our business has only been impacted a little bit, and so we're taking that money to basically invest in hiring people that know what this business looks like when we're a lot bigger. So like a director of recruiting, a head of information technology. And so we're able to make investments now that we weren't able to make. And so, in the, that book about, getting through no man's land, they pretty much say, well, you either have to decide to stay small or go out and get some funding or get acquired and all this kind of stuff. And we think the PPP money gives us an option that like never existed before.
Well, that would be a really good thing then, Jim. That would be really cool.
Yeah.
How about Samson, you, just a minute left here also. How are you feeling today versus March, when things kind of collapsed on you, and what's your outlook for the industry?
I feel a lot better, certainly. I think my blood pressure has dropped quite a bit since March. That's good. But the industry is very bullish. Dentist is an essential service. The patients that always have toothaches, they always need to go to the dentist. And I think there's on the industry level, there's a lot of studies that saying that 20% of dentists are not going to come back. That's how bad it is. It's going to shut. They just, like if you were close to retirement, it's like, screw it. I'm just not going to come back. And a lot of hygienists are actually very hesitant in coming back to work as a hygienist. So there's going to be a staffing shortage in dentistry because of that. I have a fair number of hygienists like, I'm not so sure. I probably don't want to become a hygienist anymore. I'm going to look for something else. And assistants the same way. And we have a couple of older doctors that think about, I'm just going to retire. So there's going to be a staffing shortage, and there's going to be a practice shortage. And from an M&A perspective, just like what Jim was mentioning before, there was a lot of doctors and practices were on the fence about selling. After they went through this, the additional cost of improving the practice to be safe for coronavirus is substantial. So a lot of offices are thinking, you know what, I'm just going to not go it alone. So actually, I have so many people reaching out to me wanting to sell their practices, and I have so many people reaching out to me wanting to buy my group. So I'm getting hit on both sides, where there's sharks over here and there are minnows over here. It's kind of strange, but so I think
watch out for those sharks.
So there's just a lot of activity. It's going to heat up even more, and I think it's being a catalyst to make people more determined to do what they want to do if they're on the fence. But as an industry, because of the pent-up demand, the last month and this month and next month, there's going to be a overcorrection, a lot of pent-up demand from patients. So what I'm seeing in talking to a lot of the industry groups and other groups is there's an overconfidence going on in there. So by me, like my number one cautionary tale for myself and my team is like, don't be overconfident. Just because the offices are busy, hitting the ground, they're opening and they're doing well. Everybody's doing this. They're patting themselves on the back, saying that what a great job I am, what a great leader I was. I showed this whole crisis, and I was like, don't think that way. It's going to look good for a couple of months, but the old problems, if you never solved it, it's still going to be there. Got to focus on fixing it, and just don't let the numbers fool you. There's more to the numbers. Just because there's a lot of people backed up doesn't mean that you did a better job. It just means there were people backed up. So to me, that was my thing. But as a whole, I'm very optimistic about the industry. And our 2 acquisitions have paid off in the last month or so, the numbers. So we're estimating that we're still going to outperform 2019, even though we had a coronavirus impact. And so we're lucky that it was a shorter impact than we thought, and we're going to be able to do better than we did. So,
well, good for both of you. It sounds like your businesses have been strengthened through this, perhaps significantly, and you both are incredibly optimistic of the future of your industries, which is wonderful. It also sounds like you guys have really good business models for kind of the times we're in. So I want to thank you, Samson. I want to thank you, Jim, for the gift of sharing your experiences in the middle of this crisis with us.
No, thank you.
Yeah, thank you.